Hi guys, as most of you will know, my name is Dr. Stephen Diep. For those who don't know, I'm one of the Juv'ae telehealth doctors, and I just wanted to have a brief chat with you about when to say no to particular patients. I'll break it down into various segments. The first one being medical reasons why to say no. If you think about the treatments that are on offer, anti-wrinkle and filler. Anti-wrinkle basically works on the neuromuscular junction. So for medical reasons, if anyone has a neurological disorder or a muscular disorder, then we need to consider if the patient is suitable. So conditions such as multiple sclerosis, Parkinson's, anything of that nature, we really should be considering if we should be getting specialist clearance first. If a patient is stable and has had treatment before, then generally speaking, it will be appropriate for them to have the treatment without specialist clearance. Regarding dermal filler, if you break it down into what dermal filler can do to the body, it can elicit an inflammatory response. So any inflammatory conditions, any autoimmune conditions, we really should be flagging those patients as potentially high-risk patients. Generally speaking, for first-time patients that do have any inflammatory or autoimmune conditions, it's usually a good idea to get a letter from the specialist. That way the specialist is aware that the patient is having these kind of treatments and that we're not treading on anyone's toes. We must remember that cosmetic treatments are elective and that they should always come second to other medical treatments. If a patient has medical treatments in the pipeline or in the near future, it is probably best to wait until all those medical treatments are complete before undergoing any cosmetic treatments. That leads me on to the next point, which is any patients that have undergone surgery or are about to undergo surgery. If a patient has recently undergone surgery, then their body is in a state of recovery. Their immune system isn't quite stable yet as their body recovers from such surgery, in which case it's always best to wait a good amount of time before undergoing further cosmetic procedures. This will be on a case-by-case basis. Generally speaking, if a patient has had major surgery, it's best to wait 6 weeks. Possibly shorter for less complicated procedures. This also encompasses dental work. Generally speaking, any major dental work will require 4 weeks wait. The next topic I'd like to cover mental health conditions. Mental health has become a big focus in our industry, in particular body dysmorphic disorder. From a mental health point of view, we like our patients to be stable. When treating patients with anxiety, depression, or other mental health conditions, it's really important to try and gauge what their treatment is. If a patient has been on medications long term without any recent dose changes, then one can safely assume that the patient is mentally stable. As a health professional yourself, you should be able to elicit whether the patient is to an extent mentally unstable. If a patient seems rather anxious about treatment or is quite teary about treatment, then that's usually an indication that the patient is not particularly ready for that treatment. If you're ever unsure, you can always consult telehealth. Which leads me on to my next point, which is post-care. If you can't treat the patient, it's always a good idea to have a network of other health professionals that you can always refer on to.